The Medical Admissions Unit ambulatory care pathway has been created for safely managing and treating patients for suspected lower limb DVT. This requires a multidisciplinary approach to ensure that the patient receives the best care. Direct-acting oral anticoagulant or DOAC therapy provide benefits in ambulatory care. DOAC therapy involves oral administration, no routine coagulation monitoring requirements, and a single drug approach with apixaban and rivaroxaban. They are high-risk medicines and have the potential to cause harm when used erroneously, leading to significant adverse events such as major bleeding or increased thrombotic risk due to suboptimal treatment. Recent incident reports have identified uncoordinated processes within the lower limb DVT ambulatory care pathway, resulting in unsafe prescribing of anticoagulation and lost opportunities for follow-up, patient education, and communication between primary and secondary care. Examples of incidents with DOAC use include drug dose omissions, multiple methods of supplying DOAC medication leading to inconsistencies and treatment delays, inadvertent prescribing of a DOAC in combination with another anticoagulant or antiplatelet, overlooking contraindications for initiating DOAC in pregnancy and breastfeeding, failure to educate patients about their diagnosis and follow-up and counsel them on the safe use of the DOAC prescribed, errors resulting from insufficient team communication and documentation, inappropriate patient referral to the lower limb DVT ambulatory care pathway. This refresher has been developed to streamline processes and clinical decision-making, improving efficiency and ensuring consistent high-quality care.
Typically, a patient may present directly to emergency department and be transferred to MAU. When a patient presents with suspected DVT, the initial assessment must include a detailed medical history, thorough physical examination, and relevant baseline bloods. Targeted investigations should be done in patients with symptoms, especially in unprovoked thrombosis. Medical history should include risk factors for DVT, pregnancy and breastfeeding status in young females, history of renal or hepatic disease, significant bleeding or risk factors for bleeding, and drug history including any allergies. A recent weight must also be arranged so the creatinine clearance can be accurately captured. Patients should have a thorough physical examination, and the 2-level DVT well score should be used to assess the probability of DVT. For an unlikely DVT well score of less than 2, the likelihood of DVT can be further determined by a D-dimer test. When interpreting the D-dimer levels, consider an age-adjusted D-dimer score threshold for patients aged over 50 years. If the D-dimer test result is negative, think about alternative diagnosis. The patient should not be referred to the DVT pathway. For patients with a likely DVT well score of 2 points or more, or if the D-dimer test result is positive, the patient should be referred to the DVT pathway. It should be noted that patients who are not suitable for ambulatory management or patients with upper limb DVTs are excluded from the ambulatory DVT care pathway. If DVT is considered a likely diagnosis, the patient enters the DVT pathway and initiated on appropriate anticoagulation suited for the individual patient. In the absence of contraindications, all patients are offered DOACs, that is, apixaban or rivaroxaban, as the preferred anticoagulation. It is important to document in the DVT booklet and complete an electronic discharge summary. A printout of the discharge summary should be handed to the nurse who will then dispense the 7-day TTO pack from the ward Omnicell to the patient. The patient should receive their first dose of anticoagulation from the TTO pack whilst in hospital. Ensure communication of diagnosis, treatment plan, and follow up clearly to each patient. Use the counseling checklist and safety net patients. Patients should be discharged on the DVT ambulatory care pathway with interim anticoagulation, that is, a 7-day TTO pack of DOAC, apixaban or rivaroxaban. Establish plan for follow-up with the patient.
Compliance to the lower limb DVT ambulatory care pathway is mandatory to avoid complications. For further queries, contact the DVT nurses or the senior doctor on call. Thank you.